Diabetes, it affects over 25 million people in the U.S. That's about 8% of the U.S. population. That's almost 1 out of every 10 people get affected by diabetes or actually diagnosed with diabetes. We're going to find out a whole lot more with my special guest, Dr. Sudesh Kumar. Welcome to the show, Dr. Kumar.
It's my pleasure.
Now, Dr. Kumar, to everybody knows, is a professor. He's a dean at Warwick Medical School. He's also a professor. He's a director of Institute of Digital Healthcare, University of Warwick, and he's a consultant endocrinologist at University Hospital Coventry in the UK. We just don't have enough time for all the titles. Let's welcome Dr. Kumar. So, Dr. Kumar, diabetes, is it as prevalent in the UK as it is here?
Yes, it's growing rapidly everywhere. There are some countries where it's almost it's the norm that every adult becomes diabetic. So I think, in fact, people of European origin are at lower risk than virtually every other population in the world.
Oh, wow. Let me ask you this question. I heard this the other day, and I was just kind of curious to see what you thought about it. Some people are saying a lot of countries are starting to get companies from America, such as fast food companies, casual fast food companies such as a Chipotle or a Taco Bell or McDonald's going into their countries, and this is increasing the likelihood of diabetes. Do you have any research that could support that or any ideas on that?
There's been a lot of research done by many people and all over the world, and I think we know that's something we know for sure. It's complex. Industry has changed. The way we work has changed. You and I are sitting and talking. There won't be much. This is work, but this is not how work used to be thousands of years ago. And on the other side of the equation, food has changed dramatically. So if I just take one food item, say wheat, if you look back, say 150 years ago, we had many types of grains, and they tended to be wheat and whole. But now we have highly refined wheat in everything from noodles to strudel. So I think that's down to industrialized food production and all that, which does have a value in one sense, but there's a disadvantage in terms of health. Then, of course, we have systematically removed fiber from all our foods and increased sugar, which again creates high risk. I was reading with interest some US statistics. I was astonished to hear somebody estimate that in the US alone, it costs $3 trillion a year from obesity and diabetes alone.
I'm not quite sure
how I think that they include in that all the societal costs and everything else, but there are other estimates I've seen which suggest it's $500 billion a year. Now, it's a big amount of money just for healthcare alone. European estimates, again, expensive, but again, they must be calculating it differently, or it's very cheap to deliver healthcare in Europe. They say it costs about 15 billion euros in Europe every year, just diabetes. I would call it diabesity, the twin epidemics of and the linked epidemics of diabetes and obesity.
That's a great point. Actually,
so it's expensive.
Go ahead. What were you going to say?
So it's a very expensive condition for society, and of course for the individual it is devastating.
Absolutely. And actually I want to talk a little bit about that since you mentioned the obesity part. You did a lot of research on that. What have you found in regards to obesity-driven diabetes?
So I think this is a very big problem, and if I discovered the solution, I would be a multi-billionaire. I think that's one. But this is one where numerous researchers worldwide are trying to get to the bottom of this. And the problem is that it's a very complex problem. First, there's a question, why do some people get obese? Or why do some populations become obese while others don't? And the answer boils down, there are 3 levels at which you can answer this. First, it's down to genes, genetics. But then once you have it, you can't do much about it, at least today. But what changes the risk is the environment. So the environment we live in has a major role in conferring this risk. And then, if you boil that down to habits, it's down to the food you eat and the activity to burn off that food. And that has changed systematically for all of us. And this is, of course, behind the obesity epidemic. If you dig deeper, it gets more complicated. There are questions like, why do some obese people become diabetic and others not? And that's something where I personally have also been involved in a fair bit of research. There are chemicals secreted by fat cells that cause that become inflamed, and this appears to cause an increase in risk of diabetes. Then, of course, every time we eat, we are feeding not just ourselves, but about 1.5 kilograms of bacteria in our guts. Now, the bacteria are part of normal, gut environment, but actually, if you always eat an unhealthy diet, it looks like the bacterial colony changes, and that there's a specific footprint of bacteria associated with obesity, and I think that's a very interesting area of research. So I've touched on bacteria in the gut, inflammation, and then there's another very important factor, and then I'll stop with that. I could go on. The third factor is actually that once you start becoming overweight and you've filled up your fat stores, fat really has to go somewhere else, and it starts getting deposited in organs, things like liver, around the kidney, and so on. And this is harmful. So fat in the wrong place is very harmful and increases risk of diabetes, heart disease, and so on. So as you can see, it is complex, and there are many factors that that takes a person on the journey from being overweight to having diabetes.
Let me ask you this question. You can correct me if I'm wrong. There is a sheath, right? There's a sheath that covers a lot of those organs called the omentum.
Yes, the omentum is actually something that covers all the intestines. Normally, there isn't much fat in it, but as one gets overweight, you get a lot of fat in the omentum. And that fat is supposed to be particularly bad because it secretes a lot of inflammatory cytokines.
That's a problem. That's what I've heard. And does it limit the production of the liver, and it also affects the production of the pancreas?
Yes, ultimately the pancreas has to produce insulin, and that insulin production starts to go down. Some research that I was involved in many years ago, what we showed was that fat, especially in the omentum that you mentioned, produces cortisol, which is the stress hormone. So apart from the normal gland that makes the stress hormone, once a person gets overweight, their own fat starts making more stress hormone. And that is one of the factors that also is set to link overweight to diabetes.
Jeez, so you can't be stressed and you can't be heavy. Woo, it's going to be a tough fight, Dr. Kumar, tough fight. Let me ask you this. You mentioned something earlier about fiber. That seems to be pretty big. I've spoken to some people before about fiber and how important it is. And some people tell me it's the ability to process sugars properly. What's your take on the influence of fiber and its role?
Yeah, I think fiber has a very important. It's of course part of natural diet. If you eat like a paleo diet, go back a couple of thousands years ago, if you can't pluck it, if you can't catch it, you don't eat. That's not and of course that type of food you actually consumed with the fiber in it. But of course industrialized food production, particularly in the last century, meant that systematically we've removed a lot of fiber from foods and processed them. So it makes it very palatable, and if you're in a hurry, you can consume a lot of calories very quickly, but it's not healthy. And it's not just for weight or diabetes, it's also linked to increased risk of bowel cancer. And so it's not just about metabolic health, it's also the gut health and so on. There are some other factors, and I think here you asked a very good question, which is over the last 30-40 years, I think there are two areas of science that have advanced a lot and cast a lot of light on the subject. There's one that's missing, and I'll tell you what that is in a minute. The first is our ability to do computation or mathematics has increased tremendously with computers and everything else. What that meant is that we are now able to analyze large amounts of data and look at lifestyle influences on health and all that. And actually, that's taught us a lot, including some of the things I've just told you. The other area of science that has advanced a lot is understanding cells. So we know a lot about, how the normal functioning of a cell gets disturbed through cell biology. And the bit that we have not done enough of, I believe, in the last certainly 30, 40 years, is getting back to the human being, the whole human being. So ultimately, you can go so far with reductionist science, and we have learned all of this. We now need to translate that knowledge into human beings. So, for example, at Warwick, we have established a metabolic chamber in which we can study the whole person in controlled environments and then test some of these things. What does lack of sleep do? What does eating too little fiber do and to energy expenditure? Because you also burn more energy eating high fiber diet. You have to chew it, and it goes through your whole gut, etc.
Interesting.
And yes, so I think this is an area of working on whole human beings. I think we need a lot more research on. And I think that's when we can actually put together what we learn from genetics, what we learn from many of these other sciences, and into maybe future therapies. Let me give you one example. Again, understanding how people think. If assume you are at risk of diabetes and you've seen your doctor. Suppose you are told, eat plenty of vegetables, 6 portions a day, have 1 hour of vigorous exercise a day, and don't eat bread, don't not too much pasta, and rice and so on, and keep doing that every day of your life. Yeah. In a month's time, if when you go to a meeting, you are given a pizza, would you eat it?
If I've given it up for the month?
Yes. No.
Yeah.
Yes. I think this is the challenge. As a physician, you have contact with the person for a short amount of time. You can tell them what's right and so on. The first problem is how the person perceives it. It all feels too generic. What people want is much more personalized advice. And I think that's, again, some area where we need more research. That is, what people want to know is, what kind of foods are good or bad for me, and that takes us into a whole different space. So we are used to having one drug for everybody, and one diet for everybody. But I think there's more research to be done on personalizing nutrition and personalizing lifestyle choices.
Absolutely, I think that's a great point, because it does. Some people don't care about the pizza, some people do. I unfortunately have a terrible sweet tooth. So yes, I have to fight. Let me ask you this question: what about fruit juices? I heard those are not very good for you.
No, again, I think if you're eating a fruit, actually biting into it and chewing it, you do a bit of work. You burn a bit of energy. Now, that's not a lot, you might say, but every little bit counts. So let me give you a little bit of calculation for that. Most of us during an average year will eat about 1 million calories a year. But the amazing thing is that the human body manages to match the energy expenditure almost perfectly in most of us. That's why we don't gain weight. But of course, some of us will be a small error. And that error is a lot smaller than what most people think. So let me give you if you have an average person, say 2,500 calories is what their average energy expenditure should be. 1% error comes down to something like 25 calories. That's, almost nothing. And that over a year can build up and lead to weight gain. So you can see how easy it is to gain weight with just small differences between energy intake and expenditure. And this is an amazing thing that we need to learn more about and see what disturbs this balance and what we can do to help achieve the balance. So those little things like habitually drinking fruit juice instead of actually having the whole fruit, will start to make a small. Of course, it's worse if you add sugar to the fruit juice.
Yeah, that's what I was thinking. Some of the fruit juices out here in America are loaded with sugar.
Yes.
That's a big problem. We actually have a question from the audience, if you're willing to take it here. This is James from North Dakota. He wants to know, Dr. Kumar, is it better to exercise right after a pasta or any kind of high sugar meal to burn off what you just ate, or just exercise throughout the day? It doesn't matter.
I'm not an expert on that particular point, but I happen to know, and this is what I do myself. Don't go to exercise on an empty stomach. You have to eat, preferably immediately before. If you have something an hour or two before, that's good because you need the calories to burn off. If you go on an empty stomach, you're not going to be able to push yourself as hard as you might be able to with some nutrition on board.
Here's a question from me. We were talking a little bit about every little bit of energy expenditure counts. I know there's studies out there that say that the brain can consume up to 20% of our calorie intake. Does somebody who thinks a lot, a philosopher, for instance, or a student at med school, does the brain burn enough calories to justify anything on that?
Well, not to compensate for the amount of food we are eating. Yeah, it is true. The brain actually takes a lot of energy. But actually, a small increase will not compensate for the huge increase in calories that usually are the problem. And I think the other problem is that the whole thing functions as one system. So actually, you've heard in the past they say a healthy mind, lives in a healthy body. So that's kind of true. So you actually want the whole body to be healthy. So someone who is actually exercising, it increases blood flow to the brain and so on. And there's a whole feeling of well-being, which is important to good mental functioning as well as physical. So I think that's again another theme, which is not enough people are spending time looking after their mental and physical well-being today. And I think that's a shift we need to produce. I think people start worrying about their health when they have diabetes or when they have problems due to diabetes. That's not when you actually have to do something about it. You need to start doing about it well in advance. Tomorrow, I guess, soon, we will have very advanced genomic information. I can see a time when we could have on a USB stick our entire genome, sequence. Of course, we don't know how to interpret all of it yet, but that will come soon. But that will allow us to judge risk of different diseases and much more, and understand what types of activity are bad for you in particular. And I think that's much more powerful because it allows a therapist to talk to a patient and say, for you, this is not right because this doesn't interact well with your genotype.
Let me ask you this question. As being a doctor, an endocrinologist, and working there, do you see a lot of patients that use medications as a crutch?
Yes, too much, I think. I think what's interesting is that particularly in the latter half of the last century, we saw a huge increase in the number of drugs available to treat all sorts of conditions. In fact, if you go back to earlier parts of the last century, you had about 400 drugs, and then actually you don't even need to go there. But now, last time I looked, there were over 6,000 licensed drugs. Now, sure, we need new drugs all the time for a number of health problems. We need better drugs, but at the same time, I think there's far too much drugs being used, and without actually thinking about other aspects, things that people can do themselves. I think there's a bit of individual responsibility here that is to have the right lifestyle and all that. And drugs are something that you use, after that, to control risks of disease.
That's a good point, because I see a lot of people who are taking the drugs and then they're eating their piece of cake and they're that's fine. Da 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 da. It's like, okay, 2 more questions and then we're going to wrap up. This has been a fascinating conversation. I want to let everybody know Dr. Sudesh, he's calling us from the UK, believe it or not. It's a little late over there. We really appreciate him taking the time out to help us out with this big issue. The last 2 questions before we go. One question was alcohol. Is alcohol have any significance in relations to diabetes?
Yes, I think first thing to remember is that alcohol itself has calories in it. So just because you're drinking it and not eating it, it doesn't mean that actually there's a significant number of calories in alcohol. And in UK now, there's a new policy directive now from our chief medical officer to dramatically cut alcohol intake. In fact, the advice is don't drink at all if at all possible. So that'll be a big cultural change here. But I think that just recognizes the seriousness of the problem. And the other problem is now this is amusing, but organs like the liver will use alcohol first for, as fuel before it tackles, other fuels like fat and glucose. And I think, again, you get a fatty liver from consuming too much alcohol. So I mentioned earlier, you get a fatty liver from having overweight and when excess fat goes to the liver. But another way of getting it is by having too much alcohol. And again, both of them are not good for you. That causes long-term complications. So so the short answer to your question is no, alcohol is not. So it must be had in moderation.
Everything's in moderation. Last question we want to know is actually, what would be some of the significant tips you could recommend for people out there, either to fight or to mitigate the chances of getting diabetes, as well as managing it? Any big tips that you can recommend that you've seen great studies on or successes with?
Yes, I think some of the studies that have shown a reduction or even reversal of diabetes showed that you didn't actually need to lose a huge amount of weight. So for something like 15 kilogram weight loss, completely reversed diabetes in some studies.
Wow.
And of course you may have heard that there are operations done to reverse surgery. The reason why they work primarily is because you lose a lot of weight with those operations quickly. Now, of course, it's more complicated than that. There are other factors, but the weight loss is a significant part of that. So one of the things people could do is actually doing lots of simple things on an everyday basis. The fat diets, they might work for a bit, but then it's difficult to sustain. So it's actually, making sure you get enough exercise every day. And there are different exercises that people prefer, but the important thing is people get out there and do something. And then actually, first message is reduce your calorie intake. Before getting into controversies of what sort, if you reduce calorie intake, it helps. One tip from our research was eat slowly. Because we did an experiment a couple of years ago where we had some participants eat the same amount of calories in 10 minutes, and another group ate it in 40 minutes. Without any doubt at all, those who ate in 40 minutes had a healthier profile of all metabolites we measured and so on.
Wow.
And actually they felt fuller afterwards because the brain takes about 20 minutes to realize it's getting full. So if you eat very quickly and all things with a lot of calories all at once. So here is another quiz. Between a slice of pizza, a burger, a portion of rice, and a kilogram of cabbage, which one of those do you think has the highest calories?
Between a slice of pizza, a burger, and cabbage?
And a large portion of rice.
I would go with, I guess it depends on the burger, but I'll probably take the burger on this one.
Actually, they're all exactly the same.
Oh, come on.
But
Dr. Kumar is not playing fair.
Yes, but I challenge you to eat a kilogram of boiled cabbage.
A kilogram? What is that, 2 pounds of cabbage, I think it is? 2.2?
Yes. You couldn't eat it, but you could easily eat a burger and have the fries. And that's the point, really.
That's amazing. So same amount of calories, 2 gram, 1 kilogram of cabbage?
Yes.
Well, we're going to have to tell everybody that. 1 kilogram of cabbage. I'm going to try to challenge all the team here and see who can down a whole kilogram of cabbage. Now, your body will process that differently too, though, correct?
True, yes.
Between the burger and
it's got more fiber, yeah.
Yeah. Fascinating stuff, Dr. Kumar. We thank you so much for being here.
My pleasure.
Now, we want to know, is there anywhere we can get more information about you and what you do? Anywhere that we can go?
Well, Google seems to have everything.
So we can Google Dr. Sudesh Kumar. That's excellent. Thank you so much again, Dr. Kumar, for being here. We truly appreciate it. Well, everyone, I hope you enjoyed that. Very interesting information about diabetes, things you won't always get to hear right here on Therapy Cable Lives. We're going to take a quick break and come right back for our Psychology Report.